Zimbabweans have not heard from the Permanent Secretary, the Minister of Finance and Economic Development, Mr. Guvamatanga, for some time. This is the reason. He had to go into isolation after contracting the coronavirus. It did not affect him alone. It affected his family, all 9 of them, such that his whole home had to be turned effectively into a hospital. We're here to talk to him about that experience, what it teaches him in terms of how this country should deal with this deadly global pandemic. Thank you very much for agreeing to talk to us, and I'm glad to say that you look in good health. But it wasn't like this a few weeks ago.
No, look, it was a very different experience a few weeks ago. I did my first test for COVID. That was on the 12th of July. And after developments at the ministry's offices actually required us that we do the test. And those ones came out negative.
Right.
But things within the offices continued to deteriorate to the extent that we then asked everyone else to continue to test. But I have to lead as the accounting officer. So I had to do another test on the 19th, despite the case that I had one done on the 12th. So I had to do another one on the 19th. And the one I did on the 19th, the results came out on the 21st. So they were very fast. I was tested on a Sunday. By Tuesday afternoon, the results were out. And those ones then came out to be positive. But you see, it was just within a gap of a week. It's one Sunday, which says negative. The next Sunday, it says positive. So the question is, at what point did I then contract the virus? So naturally, there was the need to test everybody around me, because when they do what they call contact tracing. So my contacts were basically my family, but the contacts of my family were then the support staff at the house. We also had my nephews, my nieces, my sister-in-law, who were also visiting, who had actually come into the house. They were visiting from London, and they followed the normal protocol. They were also, when they arrived, they had to put into quarantine for 11 days, do the testing, but actually, they walked out of quarantine, which was a safer place, coming straight into the household, where the cases. So
at that time, you didn't know that.
We didn't know.
Yeah.
But when everybody was tested, there were 11 of us here who had very direct contact. Only 2 were negative, 9.
Right. P.S. Your whole family also tested positive, to the extent that the whole house was effectively turned into a hospital. Tell us a bit more about what that meant for you as a family.
I think it's how do you manage a 7-year-old?
Yeah.
And you see, kids these days are very inquisitive. And once you start to take them through testing, because even the testing itself for kids is for children, is a very complicated process, the PCR testing. And once you've tested them, they now want to know their results. So there was even a debate when the results came to say, do you tell them or not? But you see, we kept on telling them that the results are not out. But then we are now saying to them, look, can you take medication? And they were saying, but look, if the results are not out, why are we taking medication? So you also then have to learn psychologically even how to handle it, because you don't know how to handle it. You are not ready for it. So you are having your own debate to say, how do you tell a 6-year-old that you have tested positive for COVID-19? Yeah. But without telling them, they are now saying, but look, are we fine? Are we okay? Yeah. Then you say you're okay. But if we're okay, why are you asking us to get into this, that where they say inhalation, why are you asking to do this? Why are you giving we never used to drink all these things that you're giving us. Why are you giving us these things? You then realize that, look, you can't get away with it. You have to sit down with them, get a counselor to come in and break the news to them and say, but it's not a problem. You're not going to die. You're fine. And as long as you take the medication, you do this, you're okay.
Yes, but for you, it got really bad, and you had to be admitted to hospital.
Yeah, so for me, it got really bad because I had other complications already, which I had to deal with. Nothing severe, but I had them. But I also think that, you see, what had happened is, for some reason, I don't know why that reason, I had decided with my personal trainer, because I said to him that, look, we are doing exercising all parts of the body, but we're not doing the chest.
Okay.
So over the past month, because I train quite regularly, so my regime then included lots of chest exercises. So when the pain started, I just thought that it's pain from the training.
Okay.
So which means that we were also delayed a little bit in identifying from the testing. My lungs were already under attack. And there was also a little bit of, within the social media, lots of misinformation. Because social media will tell you that, look, this is just like any other flu. No, it's not. It's not correct in Zimbabwe. COVID is not like any other flu. Zimbabwe, COVID is a respiratory disease. It affects how you breathe. It's not like another flu.
You were explaining earlier on that it was actually very, very difficult for you to take any food.
Your sense of taste disappears. Mine was gone. Your sense of smell disappears. Mine was gone. Your appetite disappears. So, look, I know I've heard in the past people joking and say, oh, look, can we warm up yogurt for them, for him or for her, when people are not feeling well? You see, I appreciated being able to take a tablespoon of porridge. That was just a mammoth task, just to get in a tablespoon of porridge, because the appetite is completely gone. You have got fever. At one point in time, you're feeling cold. At one point in time, you're feeling hot. And the fever is not only fever. I've never felt hot on my foot. For the first time, I had fever on my foot. You could feel hot on the foot. You could feel cold on the foot. So it was very, very bad. So the reality of it is that what we've been told to say, look, you can just have ginger, you can just have lemon, you'll be fine. No, it's a respiratory disease. It affects how you breathe. So that's one critical element that you need to monitor. That if you are experiencing any breathing problems, you need to go to the nearest health facility. Don't sit and wait and listen to the myth that we have been told on the social media to say, no, just to take a ginger, just take. That helps. But if you're struggling to breathe, you need to go to a hospital. That's what I eventually did.
Here you were in hospital, dealing with your own situation, and at home your family are also affected and isolating.
Yes.
How did you manage to deal with your own situation and at the same time worry about what is happening with your family at home?
I knew the extent of the stress levels, because literally when I went into hospital, I was in hospital for a week. I was on oxygen for 4 days. I needed oxygen support for 4 days. But again, I knew that they were dealing with so much. So I had to manage the extent of the information that I was sending to the family in terms of exactly my condition. But there were times where, breathing without oxygen was almost impossible. So even the use of the bathroom became very, very complicated. Yeah? And especially without oxygen. And if I was to do it, I needed to get in very quickly off my bed, jump in, and come back. Bathing was an issue. So for 3 days, I had the nurses at the health facility bath me. I never thought that at this age I would need someone else to bath me. But for 3 days, I needed someone, because you just don't have, because if you are not breathing, if your oxygen levels are low, you just don't have the energy to even lift a soap or lift a towel. So I became a small child, because I had to be bathed and I had to be dressed and everything, and quickly put back onto the bed and quickly back onto oxygen. But that's the information that I was not relying back to my family. But back on oxygen, look, I was up and running. So because what was very interesting, when I was then reviewing, I was looking at my phone, right? I was communicating with 2 key people, my executive assistant as well as the acting secretary. You do not believe the number of things that I authorized and denied to authorize. But more interesting, I think I was angry, because one of the things that I refused to authorize was more spent on the quarantine centers. I wrote back and I said, I want more information on this.
What is your experience with COVID-19, with the coronavirus, taught you in terms of how we should, as a country, manage this pandemic?
It's a new experience for everyone, but it's just how we also have to understand our own unique situation. Because sometimes we are then forced, because of certain protocols, to follow certain guidelines. But those guidelines are actually based on societies with particular demographics, right? And our own demographics here is actually made up of the young people who can actually manage and handle COVID-19, obviously medically and scientifically at the moment, much, much, much better. So the question is, do we need the same intervention? That's the question that we then have to address. But I've also had an opportunity after I came out of hospital to have a discussion with the Minister of Finance. I've had a discussion with the Minister of Foreign Affairs. I've had a discussion with the new Secretary for Health. And what was very interesting, when I had a 1 hour, 3 minutes discussion with the new Secretary for Health. I'll tell you what was interesting. I didn't call him, and he didn't call me. The new Minister of Health, the Honorable Vice President Chiwenga, called and said, I want to introduce you guys. That's what he said. It was supposed to be an introduction. We ended up having a 1 hour, 3 minute conversation. I was parked by some police roadblock because I was traveling. Actually, I had to park my car. So for 1 hour, 3 minutes, we spoke. But you know what? Because it was his phone, for 1 hour, 3 minutes, he listened to our conversation. 1 hour, 3 minutes.
The Vice President?
The Vice President. He didn't comment. For 1 hour, 3 minutes, he listened into our conversation for 1 hour, 3 minutes. But you see, what I actually liked is the alignment in thinking. Because you see, it's very important between the ministry, departments, and agencies and treasury to be aligned. Because when there's no alignment, then implementation becomes a problem. There are always delays in implementation. Yeah? But earlier on, I was saying that, look, what was interesting is when I reviewed my phone from the 26th to the 2nd, so I got into hospital on the 26th, I was discharged on the 2nd. As long as I was on oxygen, I was fine. And as long as I was on oxygen, I was working. So if I bring my phone, you will see that there are lots of WhatsApp messages. I was still working. And I think that was actually confusing people. And one of the conversations that I was also having was even a conversation about even the cost of PPE. I started it when I was in hospital to say, but guys, why is each and every agency, department, ministry procuring their own PPE? Yeah? Why can't we have, as government, maybe one single source and benefit from economies of scale? And the other question was, why are we still paying the same price we're paying in March?
You have recovered now, but you were earlier on telling me that your experience left you sometimes angry and impatient with things that you felt were not important. And in fact that you feel you probably need psychological counseling. There's a mental side to this issue which should also be discussed. What are your experiences with the psychological side of dealing with COVID-19?
It's actually realized, because sometimes there's a thin line between right and wrong, sometimes, especially with new experiences like COVID. What is the right thing to do? What is the wrong thing to do? Because this is a new experience. No one has got as much knowledge. We are all discovering as we go ahead. But sometimes it's also then saying, how do we manage the sensitive issues? Do you sit and watch and say, we'll see how it will turn out? Or if you actually believe that something is wrong, at that point you highlight that this is wrong, and I think it has to be corrected. Yeah? Because one of our role and one of our responsibility as the treasury is to avoid and to stop what is called wasteful expenditure. Yeah? Yeah? And I have to admit, look, and we're all learning, there was a little bit of wasteful expenditure in the manner we spent, because there were things that we were told by certain protocols that we should spend money on. That, from my experience, I learned that no, those things were there, they were fine, but we should have. It's not much use. Okay. So there was so much noise, and there was so much noise on social media about ventilators. Yeah? I was in hospital. All I needed was just oxygen. I didn't need a ventilator. Yeah? And there was a ventilator next to me. Yeah? And it's a sophisticated piece of equipment, actually. But probably for the price of one ventilator, maybe you would buy 70, 80, 100 oxygen. And what we actually needed was oxygen. But you are then directed maybe to say, look, you need ventilators. So the experience will then start to show you to say, look, because it's now real. To say, am I going to get into this thing? Am I going to get into that machine? No, this machine looks like it has to come into my mouth. Oh my God, this is going to be fed. Yeah? But then you realize that, no, but you actually don't need that machine. So, and realizing that, okay, if I needed oxygen, then it means that most of Zimbabweans also need oxygen.
What advice would you give, based on your own experiences, to somebody who is probably tested positive today and is wondering how they deal with this situation?
Definitely, it's not a death sentence, right? At all. You can recover. All the 9 of us in this family recovered, fully recovered. Yeah, and the retest negative, everything else. So first of all, it's not a death sentence. Yeah, but when you see the symptoms, seek early intervention. Yeah, and it also even brings the question to say, we have emphasized testing, we've emphasized quarantine, right? But the question that is there is, if up to now, don't we know the symptoms of COVID? Are the symptoms of COVID not known? Yeah? So these were some of the reflections that I was having. And these are some of the conversations I've had with my colleagues in government. Yeah? Including the Honorable Vice President. Yeah? To say, don't we know the symptoms? Yeah? Because you see, if you know the symptoms, you would rather treat, isn't it? Because even if you're not sick, if I treat you, most of the medication of COVID, they will not kill you anyway. Right?
Yeah.
And for every one test, and I've also consulted very, very widely, for the cost of one test, you could possibly, at worst, treat 8 to 10 people. Yeah? And the symptoms are known. Okay. So the question I'm raising, which is what I've thrown to the expert, because I'm a finance expert. I'm not sitting here claiming to be a health expert. Yeah? I'm simply sharing my experiences. So if the symptoms are known, and we can actually see that these are the symptoms, why is the emphasis on testing, not treatment? Because when my symptoms became clear that they were deteriorating, they did not say that we are going to retest you again. They said, let's treat you. So I went into a treatment regime. Yeah? So these are the different perspectives that I'm saying, but we've already started within government, right? Because we've had the opportunity, and I've indicated earlier on that I've had the opportunity to have this conversation with the Honorable Vice President, with the new Secretary. So we are now saying, is there a new intervention that we require, given that there's someone who has had the real experience, and I've sat in there and I've just realized that, oh, this is what I need. This small tube running coming to my nose.
Yeah.